This week's Ask Dr. Durie comes from a patient who has a broad question about myeloma. And the question is, how important is it to try to achieve a good or a best lifestyle? Does this really have an important impact in myeloma patients? Well, truthfully, we don't have much direct research on this topic. Obviously, we would expect that having a good lifestyle should be helpful, but have we proved anything related to that? Well, we do have some information. For example, through our Black Swan Research Initiative and iStop program in Iceland, we've been looking at what is the impact of the diet on progression of the myeloma in Iceland. And it has been reported already that in patients who continue or stick with the traditional Icelandic diet, which is high in locally caught fish, this results in a lower risk of disease progression versus individuals who have shifted to a more modern westernized diet with a lot of fast food and meat and other types of components, processed foods. And so there are data in that situation. What other kinds of information do we have? Well, we also know that in patients who are overweight, and this is true for many types of cancer, there is an increased risk of progression of the disease. We also know that in areas where there is inflammation or trauma, there is an increased chance that a focus or spot of myeloma might develop or grow. And so we do have some indication of that type of risk factor. And overall, we know that frequently the onset or activity of myeloma is linked to the onset of active infections, whether that might be pneumonia or possibly shingles. And so, although we don't have the detailed comprehensive information that we would like, one can say that it is a good idea to think about achieving a good or better lifestyle to try to have the best outcome if you are a patient with myeloma. So it's good to try to have an excellent diet, to perhaps have some degree of exercise to maintain a good weight, and also to bring any other diseases under control. If there are any other medical conditions present, which could be recurrent infections or blood pressure problems, heart problems, any other problems that could contribute to inflammation or stress and the like, it is important to bring all of these things under control. And so bottom line here, it is a good idea to try to have the best lifestyle, and I think that it is indeed contributing to better outcomes for patients with myeloma.